Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Marc Lanuza. Marc Lanuza is a family medicine physician assistant with the Washington Hospital Healthcare System.
Our lecture will be on taking care of your health, and giving a time for this to yourself is one of the best gifts that you can give to yourself tonight, because we will be learning a few things that might be effective in making healthy living and eventually healthy aging. I was talking with Miss a while ago. We will be also learning healthy choices to maintain and protect and improve our aspects of our health. I will be presenting the lecture in a prescription format, the taking charge of your health in a prescription format. So as a prescription, it's a take-down order. And we will be talking about 7 items here. We will discuss each item one at a time. And at the end of the lecture, we will be able to learn the ways how to better take care of our health problems. And taking care of them, eventually we will have healthy aging at the same time. Number 1 is creating bond with your primary care, which is very important. And this is one way of staying in one primary care provider. Some folks, they have from urgent care to urgent care, some ER, and it will be best so that you can center your medical problems to a primary care unit, primary care center. Part of the taking care of yourself is schedule a physical exam. Physical exam, which includes your blood tests, because there are things that we do yearly exams, and we also need to understand healthcare indicators. These are measures that will check some of the ongoing medical problems that we have, and those are things that we can do to trace the progression and comparison readings. Also, keeping track of our records. Then, mind you that sleep and stress is part of getting ourselves to take our healthcare better, and it's part of making ourselves have healthy living. Then also doing this, we can also do improvement with the lifestyle, which reflects in our nutrition and daily activities. We have a picture here too, which depicts realities of living, realities of eating, realities of activities, and realities of going to the hospital when we get sick. So we call him Uncle Tom. Uncle Tom on the other side is, let's describe the activity. It's sedentary living, is nicely resting on a couch, and nutrition is eating processed food and soda there and hamburger. So we can say that Uncle Tom has some chronic medical problems, and we don't know how Uncle Tom takes care of his annual exams. And as we get older, if Uncle Tom has primary care settings, health screening practice parameters should have been addressed, like A1C, blood pressure, weight. So we don't know if Uncle Tom has a primary care, because those are the things that we learn when we do our health screening and annual exams. Probably Uncle Tom is not aware of risk and complications also. And we don't know if he is giving a gift of health. Gift of health is visiting your primary care provider once a year. And the second picture, now Uncle Tom is in the hospital. So probably Uncle Tom had just dizziness, because it is less gadget attached to Uncle Tom. Probably had just hypertension or chest pain. And according to Communicable Disease Control and Prevention, that The leading causes of death in the US are heart disease, diabetes, cancer, stroke, Alzheimer, and kidney disease. Remaining physically active and eating healthy can help us manage leading causes of death that we have mentioned. First in the topic here is creating a bond with your primary care. Who has primary care providers here? Who has primary care? Okay. And you are at a major primary care center of Washington Township Medical Foundation, which is a part of Washington Hospital. This is a primary care center in the city of Newark. This is generally a gift of the hospital for the city of Newark. And around here, majority of you here has a primary care settings, and primary care providers are the one that takes care of our overall health. And the first topic here for knowing in charge of your health is to create bond with your primary care physician. So let's go with the next slide. The next slides depicts patient's playbook. Who have seen the patient's playbook? This is one of the book. It comes with an audio book that has been released in 2015. It is a nice book. And Washington Hospital Healthcare System has adopted seven philosophies from this book. And if you want to read that book, it is a very nice book that helps us. We'll become a healthcare consumer and we'll become smarter in doing healthcare consumer needs. Knowing these 7 philosophies will create and deepens the bond or our relationship with our primary care. It will outlines the 7 questions that we might have to monitor as we go with time. You need to ask this primarily to your primary care physician, not at one time, but you can have them different visits. Make sure that you have this in mind. First is, how can I reduce the risk of heart disease? Second is, how are we going to catch cancer before it catches me? The next 2 pertains to chronic medical problems that we take medication for them. We have a person there that is divided into eating healthy. Let's say for high blood pressure. High blood pressure, your patient's education for high blood pressure is regular activity and low salt diet. So doing that sometimes you can modify. It's either reduce the dose or even modify not taking your prescription medication as we do this practice. So next question that you can ask to your primary care provider is, what medication can we stop to minimize? And is there anything I should do differently to live a longer life? Eating healthy and regular activity. We can modify some of our chronic medical problems. What are the latest news in my condition? And something is bothering me, can we talk? So as your primary care provider, you should be able to discuss things with your primary care provider if something is bothering you. And after your visit, you can always request a copy of the things that you talk that might help you analyze yourself better in terms of taking care of your health. Analyzing this routine sometimes will help you modify all the things that you need to do every day. According to the National Council on Aging, folks with chronic disease who learn how to manage their symptoms can improve the quality of life and reduce their healthcare cost. So those are the things that you can always remember when you bond with your primary care provider. Next in line is the item, schedule a physical exam. Physical exam is usually annual exam, and doing an annual exam, you can associate this to your birthday, to your Father's Day, Mother's Day, before summertime, after winter time. So those are the things that we can do on physical exam. There are things that we do in physical exam. It is early detection of health condition, health problems. Detecting those by your primary care physician can modify and eventually takes care of your chronic condition that will become worse later on. With your physical exam, we do also annual blood tests where we can do corresponding blood test analysis, checking some healthcare parameters at the same time. Your physical exam includes your personal history, your family history. Most important are your vital signs. Vital signs are your blood pressure, heart rate, respiratory rate, pulse oximetry, and pain, and gather other information to get an overview of your health. So this is what we do. This is what we do as your primary care physician when you come and see us for your annual check. As we were talking, it comes with an annual blood test and includes additional screening if needed. Doing your physical exam and follow-up will determine your follow-up depending on the results of your blood test most of the time. Every 3 months, every 4 months, or sometimes twice a year. Don't forget when you do your physical exam to always write down something else, because when you go for your physical exam, we tend to forget. And to the discussion, to the story of your provider and you, next thing to happen, you miss some of the items that you need to discuss with your primary care. So it is very important to write down something else before you even go to your physician. So you will be addressed all the things that keeps on bothering you. What happens if I don't do anything? Sometimes when we go and see our provider will say, take this, take that. Then you are there listening, and what if I don't like? So what if I don't like to take my medicine? What are the things that might happen? So you can ask that to your provider. Understand health indicators. Health indicators are special items that help us survey chronic medical problems like heart disease, diabetes, blood pressure, and hyperlipidemia. These are your parameters to check. For your BMI, this is a prescribed weight to height. Generally, healthy BMI is 20 to 25. 25 to 30 is overweight, and more than 30 BMI is obese. So those are the things that we check when we go. Blood pressure, very important to check. Blood pressure resting. You need to tell your medical assistant if you were rushing to come to the clinic or you did something else. There is a big news that bothered you and you got it, and it influenced your reading, of course. So let them know that your blood pressure is a little high, and can you repeat it after 5-10 minutes. Heart rate and respiratory rate, likewise. As we said, annual exam comes with annual blood tests. So we will check generally for complete blood count. We check generally for CBC, check for anemia there, basic metabolic panel for electrolytes, your potassium, glucose, and lipid panel. Lipid panel, how well good cholesterol are displayed, and bad cholesterol, your cholesterol of exercise, your HDL, all the things that we need to know. If you can write that down or have them printed out for you, so it will guide you in your daily activities and daily food intake also. And your A1C, which is special, it's a measure for diabetes. It's very special. And indicators, those are major ones, but younger ones, we can also add testicular cancer, part of your physical exam, pap smear, STD check, and if you are 50 and above, then we can have your mammogram, colon cancer screening, PSA for guys. Next, in the prescription for taking charge of your health is keeping track of your record. At Washington Hospital, if you are using Washington Township Medical Foundation to be your primary care, we have access to your chart, which is My Chart. You are given a password to get to our system and check your records in there. I don't know if some other organization provide that, but if not, you can request your provider or your medical assistant to give you some printouts so that you can get a binder of your records. Why is it so important? Because your personal health records should have your medication list, your healthcare conditions and medical history, dates and results of your checkup and screening test. Very important also, if you are traveling from going place to place, overseas or local, then you can have also the information of your healthcare provider. And for emergency contacts also, it's easy access. Easy access, and personally, you can do that for your personal records for progression and comparison of the numbers. Part of your personal health records is knowing your family health history. This includes your heredofamilial diseases, very special for diabetes, obesity, cholesterol, hypertension. So who are in the family who was diagnosed with life-threatening illnesses? What age did they receive the diagnosis? Who are the family members who are diabetics? Is there a history of heart disease in the family? Has there been any diagnosis of mental illness? Those are the things that we make a note of it to be included in our personal health records. Mind you that sleep and stress are part of taking charge of your health. Not getting enough sleep is very important. The following day, if you don't get a good sleep, it just reflects or affects your behavior or activity. Everybody knows that we know or we have personal experiences if sleep is distorted. Sleep, we have a separate talk about sleep, but taking sleep as a topic, part of knowing thyself is knowing that sleep deficiency increases your risk of heart disease, diabetes, obesity, cancer, and depression. Next in the knowing, taking care of our own health is stress management. Stress management is an issue of affecting our health. Common stress in living in the Bay Area, traffic, cost of living, commute, physically demanding job, childcare, and our coping up to the demands of our work. So it is very stressful if we were not able to handle this. You have stress management techniques. Washington Hospital is offering lectures on yoga, meditation, and Tai Chi. So if you are interested to attend those classes, you can check the bulletin for this. People that learns to manage stress leads to happier and healthier lives. We have tips here for stress management by keeping a positive attitude. Everybody has to live with their stress, but keeping a positive attitude is very important for us to cope up with the demands of the position we are in, situation we are in. Time management, like traffic, for instance. So getting up early and travel early. So those are the things that we can do. And having hobbies, interests, and forms of relaxation to decrease our stress, depending on our stress level. Interpersonal relationship also has been a stress in the workplace, family, and outside family and work. So be assertive instead of becoming angry, defensive, or passive. Stress management also, setting limits, saying no to requests that would create excessive stress in our lives. Next, in taking charge of our health is improve your lifestyle. What lifestyles are in there? So, eating lifestyle, exercise lifestyle, eating healthy, remain physically active, regular screening will help us avoid serious health issues. Eating healthy, and in our plate, it reflects in our plate. It should be a balance of nutrition there. Some fruits, make sure that, let's see, the vegetable there has more portion, proteins, lean proteins, grains, whole grains, and fruits and vegetables. So we have also low-fat dairies there, limiting added sugar, sodium, and trans fats. Trans fats are the unsaturated fatty acid. They are the ones that usually enhance the flavor, look, and taste of the food that we eat. And they come sometimes as a label for partially hydrogenated oils. So watch out for those. If you don't see trans fat, so it pays to read labels, read trans fat or partially hydrogenated oils. Those are the same. Build a healthy eating style. So let's be realistic with our goal. We need to have meal planning, eating on a budget, understanding the labels when we go out there and buy our foods. Exercise. Exercise is recommended for 30 minutes of moderate exercise, 5 days per week. It's not usually 30 minutes all at one time. You can do an increment in a total of 30 minutes. You can do some 15 minutes, and another 15 minutes in your next break. So total increment to make it 30 minutes. Something like in your break, you can do that end of your day. Exercise sometimes, regular exercise, and up to a level that you will sweat. At that time, you can continue more 15 minutes, and that will be one of the best measure for optimum exercise. You can do some muscle strengthening activities twice per week. This all adds up to making ourselves active. Putting physical activity in our daily life likewise ensure success. Or just have fun. Put on those sneakers, rubber shoes, and leave excuses at home and get out. Sometimes we will find a exercise buddy there. So if you are coming for Washington Township Foundation as your primary care clinic, after your visit, we usually give a after-visit summary. It outlines your medication, it outlines your diagnosis, it outlines your prescription, and your next visit. So today's lecture, it outlines the 7 parameters that we need to check so that we can say that we are taking care of our health, taking charge of our health. So first is we need to create bonding with our primary care, because primary care takes care of the overall health picture of us. Remember the 7 philosophies that Washington Hospital adopted from patient's playbook, very special, that you need to write down so that you can ask your physician or primary care provider when you go and visit. Gift of health by doing your physical exam once a year. You can do that on your birthday, around Father's Day, around Mother's Day, or before summertime. Those are the favorite dates for physical exam. Because in physical exam, after that, we do review of your health profile, history, alcohol intake, surgeries, and new family histories. And next is to understand your health indicators. These are part of your annual blood test, especially your A1C for diabetes, cholesterol profile to check for hyperlipidemias. Blood pressures are very special. Tell your MAs if you are under stress to reach the clinic and have them repeat after 5-10 minutes. And your A1C. A1C is a very specific test for diabetes. That is very special, once a year. And if you're diabetic, then you can have that more than once a year to be checked. Those are just to check comparison and progression of chronic disease problem like diabetes to get worse. Then keep track of your record. It is very special to keep track of record. If you're a patient for Washington Township Foundation, we encourage our patient to enroll to MyChart. Then using their password, they can check their records. Or if you have no access with checking your system, you can ask a copy from your provider or your MAs to give you a printout. And in your free time, you can go and browse on those. Then you can ponder, how come my cholesterol, I'm not eating? And you can isolate intake of yours, and not only intake, I'm doing all the best I can. How come my numbers are still high? You might be dealing with familial or heredofamilial problems in case of diabetes or hyperlipidemia, things like that. Or if you are going overseas or visiting new places, have something else, a record with you, so that as a baseline, so that when you go and visit, who knows what happened for us when we go out and visit places. So you have a comparison that the blood test that was done at that time that you're sick is not the worst one. You have better blood tests prior. So put that in a binder, and everywhere you go, carry them with you. And also sleep and stress, they are part of taking charge of your health. Sleep, we need to have 7 to 8 hours of sleep, healthy sleep. And you know when sleep is distorted, it doesn't give you a nice following day. It's always nice to have a rested sleep. Stress management. Those are the things that we need to handle. Live with the situation you are in by being positive, if you can. And if you are its interpersonal relationship, it is being assertive, not being angry and aggressive, and setting up limits. Those are the things that we can do to keep ourselves controlling our stress. And the last one is to improve your health by doing a healthy lifestyle, eating habits, like avoiding processed foods, eating whole grain, low fat, dairies, lean proteins, and vegetables. And exercise. So what is the definition of exercise that we did? For 30 minutes, and slow. You can do slow increment for a total of 30 minutes. But I usually, in my previous interview, I usually say exercise until you break into sweats, then extend another 15 more minutes, and that is one of the optimum exercise that we can do. So doing some folks exercise more than that, and you are tiring the body. And if you tire the body is not looking forward for every day. So something that you can cope up almost like 3 or 4 times a day that we check there. 5 times per week. So 30 minutes, 5 times per week.